Let's go over hypertrophic cardiomyopathy, also known as HCM. Now, we know what it's called, but what is it, really? It's a cardiovascular disease that is characterized by an abnormally thick cardiac muscle. The cardiac muscle is located between and around the left and right ventricles. As you can see, the normal heart on the left side has a cardiac muscle of the average size. However, the affected heart on the right side has abnormally thick cardiac muscle identified as HCM.
Now, what is HCM caused by? Usually, it's an abnormal gene mutation, and there are two different types. There's obstructive hypertrophic cardiomyopathy and non-obstructive hypertrophic cardiomyopathy. Obstructive HCM causes the wall between the two ventricles to become thick and restrict blood flow. Non-obstructive HCM is when the left ventricle of the heart becomes thick, resulting in the decreased amount of blood taken in and pumping out.
Well, who's at risk? Let's find out. Some risk factors include family history, advanced age, and an uncontrolled high blood pressure. When we say family history, we mean that HCM can be inherited from other family members. Along with the advancement of age, individuals are also at a higher risk for developing HCM. Having a high blood pressure that is uncontrolled can also risk an individual to developing HCM.
Let's look over some diagnostic tests that can be performed to identify HCM.
One test that we can perform is an echocardiogram, known as an ECG for short. You see this image right here? This is an ultrasound image of the heart, and the white material that is labeled is the cardiac muscle. An ECG is used to check whether the heart muscle is abnormally thick by giving us an image that uses ultrasound technology.
Another diagnostic test that we could perform is by using an electrocardiogram, an EKG or ECG for short. This image on the right here is an EKG strip that shows the activity of the heart. Generally, individuals with HCM have low long-term heart rates. By identifying whether the heart rate is high or low using an EKG machine, we could possibly diagnose HCM.
For a more detailed image of the heart, patients can get magnetic resonance imaging, also known as an MRI. This is an image of an MRI scan of a heart. You can see the labeled cardiac muscle. This detailed image allows us to diagnose HCM by observing the thickened cardiac muscle.
Another test that can be done to try and detect HCM is a stress test. During this test, patients walk or run on a treadmill as it gradually increases speed. Their heart rhythm and blood pressure are monitored in order to check for any abnormalities.
Created using Powtoon.